Hello, how are you all? Hope you are fine and preparing well for AMC Part 1 exam. This is Dr. Zara and we are doing some recalls from the Gynae section. So let's start. A 16-year-old girl is brought to your GP clinic because her parents are concerned about her development. She has not started her menses yet, and according to the parents, she is the shortest of all her classmates at school. On examination, the breasts have not started budding, but pubic and axillary hair growth is present. On examination, no abdominal pus, tenderness, or rebound tenderness is noted. The remainder of the exam is unremarkable. The patient refuses a vaginal examination. Which one of the following can be the most likely diagnosis? A. Ovarian dysgenesis. B. Mullerian agenesis. C. Imperforated hymen. D. A pituitary tumor. E. Absent vagina. First of all, let's revise again the scenario. So she is 16-year-old girl and she has not started her menses yet. That means she's a case of primary amenorrhea. Primary amenorrhea because she has not started her menses yet and she is 16-year-old girl. This is the scenario of the primary amenorrhea. The next important point here is she is shortest of all her classmates. She is shortest of all her classmates at school. Now what is this statement is indicating? This statement is indicating that somewhere one hormone which is responsible for the height as well in the female is estrogen. Estrogen is deficient here because estrogen is the hormone which play a vital role in the height development. So here that's mean this statement indicating that estrogen is deficient here. On examination, the breasts have not started budding, but pubic and axillary hair growth is present. So breasts have not started budding. This statement also indicating that estrogen is not present here. Estrogen is deficient because estrogen is vital, is a most important hormone for the development and for the growth of the breast as well. So for the height and for growth of and development of the breast, estrogen is responsible. So in this scenario, breasts have not started budding. This is statement indicating that estrogen is deficient. On examination, no abdominal mass, tenderness, or rebound tenderness is noted. What this is indicating? This statement is indicating that this is wrong option, imperforated hymen, because imperforated hymen will usually present with the abdominal mass. Why? Because the menstrual blood will not get its way for normal monthly cycle because the hymen is imperforated. So patient will usually present with the abdominal mass, and along with this, with each menstrual cycle, patient will complain about the tenderness or pain in the abdomen due to the blockage of the menstrual blood because of the imperforated hymen. I hope this is clear to you now. So this is a wrong option. This is not the correct answer because two things will be there with the imperforated hymen. Number one is abdominal mass on examination should be there. Number two is patient will present with each menstrual cycle. She will complain to the GP with lower abdominal pain with each menstrual cycle because menstrual blood will block inside, and she will present with lower abdominal pain with every menstrual cycle. Along with this, imperforated hymen with a short height and breast is also not developed. So this is not will be associated, this will not associated with imperforated hymen because with imperforated hymen all the hormonal profile will be normal. She will have a normal height, she will have a normal development of the breast. So this is not the correct answer. What about the pituitary tumor? So with the pituitary tumor, patient will present first of all, the tumor with the pituitary tumor, patient will present to you with a headache. Second, she will there will be some option because pituitary tumor most likely is the prolactinoma, so there should be a galactoria, milk discharge from the breast, but there is no option, statement is mentioned in the question. This is also the wrong option. What about the absent vagina and Mullerian agenesis? So absent vagina, with the absent vagina and Mullerian agenesis, both is wrong. Why I have wrong this both options simultaneously? Because with Mullerian agenesis sometime absent vagina is associated. So why this is wrong? Because the patient will with the this there will be an anatomical uh, anatomical development problem with Mullerian agenesis and absent vagina. So paramesonephric duct will not properly work. So that's how Mullerian agenesis and absent vagina will happen. The most common uh, abnormality is with Mullerian agenesis is MRKH, Mayer-Rokitansky Kaiser syndrome, which always associated or sometime associated with renal anomaly as well. So other anatomical problem will also mention in the statement. As well as with this condition, all the hormonal profile of the patient will be normal. There will be a normal breast, there will be a normal height, there will be a normal axillary hair growth. Only during examination, vagina will be absent or short in the length or vaginal agenesis, as well as sometimes uterus will be not completely formed, as well as renal anomalies also associated with Mayer-Rokitansky Kaiser syndrome or Mullerian agenesis. So this is not the correct answer. Only the remaining option is ovarian agenesis. Now what is ovarian agenesis? Ovarian agenesis is the correct answer here. A is the correct answer. So what is ovarian agenesis? Ovarian agenesis is in which the ovary not normally functioning congenitally. So what is the uh, chromosomal abnormalities with ovarian agenesis, or what is the most common cause of ovarian agenesis? So the most common cause of ovarian agenesis is Turner syndrome. Turner syndrome is 45XO or 46XX. So this is the Turner syndrome, which is most common with ovarian dysgenesis. So ovaries will not function normally, so there will be absent estrogen, absent progesterone. These both hormone will be absent. Patient height will be not normal. She will short heighted. Along with this, breast will also not develop because of the absence of estrogen. So this is the correct answer here, ovarian dysgenesis. And the most common condition with ovarian dysgenesis is Turner syndrome. Correct answer is A. So let's read the explanation as well for this question. Menses, the final piece of puberty, is expected by the age of 16 year. Failure to menstruate beyond this age is termed as primary amenorrhea. Primary amenorrhea can be a feature of all of the given option. However, short stature makes ovarian dysgenesis, example Turner syndrome, the most likely diagnosis. This is very good explanation they have given here. During a female puberty, there are the three components. There are the three essential components. The first component is adrenarche, growth of the pubic and axillary hairs as a response to increased production of androgens by zona reticularis layer of the adrenal gland. Thelarche, breast development. The first sign of puberty in girl is breast budding. Number 3 is menarche, commencement of menses, final event in the puberty. In patients with ovarian dysgenesis, adenarche often occur around the expected time like a normal female, but thelarche and menarche are the almost always delayed due to the various extent depending on the deficiency underlying cause because of the decreased level of the estrogen, the adequate levels of which is crucial to thelarche and menarche as we discussed before. Estrogen deficiency usually lead to short stature as a characteristic finding. So biliary agenesis of this imperforated hymen and absent vagina in this, sexual development occur normally because ovaries have a full functioning. So in this condition you will get a normal hormonal profile because ovaries will function normally, but there is no menstruation because of the menstrual flow obstruction. Example, imperforated hymen or absent vagina or absent or normal menstruation. Example,